Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is anatomical snuff box. First of all, you can see here the diagram of anatomical snuff box. So let us introduce the anatomical snuff box. The anatomical snuff box is also known as the radial fossa. It is a triangular depression found on the lateral side of the wrist. It is located at the level of the carpal bones and best seen when the thumb is extended. In the past, this depression was used to hold snuff or ground tobacco before inhaling via the nose. Hence, it was given the name snuff box. So, what we get to know? First of all, the anatomical snuff box is also known as radial fossa, and it is a triangular depression found on the lateral side of the wrist. It is located at the level of carpal bones and best seen when the thumb is extended. And why the name was given snuff box? Because in the past, in this depression, the old man used to hold snuff or ground tobacco before inhaling via the nose. That's why it is named as snuff box. Now let us discuss about the boundaries. As the snuff box is triangularly shaped, it has three borders, a floor and a roof. The three borders are, first of all, ulnar or medial border. In the medial border, there is tendon of the extensor pollicis longus. In the lateral or radial border, tendons of the extensor pollicis brevis and abductor pollicis longus. So, in case of medial border, there is one tendon, that is the tendon of extensor pollicis longus, and in the lateral border, there is the tendon of extensor pollicis brevis and abductor pollicis longus. And in the proximal border, there is styloid process of the radius. And in the floor, there is presence of carpal bones such as scaphoid and trapezoid. Then roof. In case of roof, there is skin. So what are the boundaries? As the snuff box is triangularly shaped, there are three borders, a floor and a roof. The three borders are medial border, lateral border and proximal border. Medial border, there is the tendon of extensor pollicis longus. In case of lateral border, there is tendon of extensor pollicis brevis and abductor pollicis longus. In case of proximal border, there is styloid process of the radius, and in the floor there is carpal bones such as scaphoid and trapezoid. And in case of roof, there is presence of skin. Now the contents of the snuff box or anatomical snuff box. There are three main contents of an anatomical snuff box. These are the radial artery, a branch of the radial nerve, that is specifically superficial branch of the radial nerve, and the cephalic vein. So what is radial artery? In case of this snuff box, this crosses the floor of the anatomical snuff box, because the radial artery passes through a deep layer of the anatomical snuff box. And cephalic vein and superficial branch of radial nerve, these are at superficial level. So superficial branch of the radial nerve is found in the skin and subcutaneous tissue of the anatomical snuff box, and cephalic vein arises from the dorsal venous network of the hand and crosses the anatomical snuff box to travel up the anterolateral aspect of the forearm. If you see the diagram, then first of all, there is the tendon of extensor pollicis longus, there is tendon of abductor pollicis longus, there is tendons of extensor pollicis brevis. So these are the borders, and the red colored artery is radial artery. And in this diagram, you can see the clear cut. There is tendon of extensor pollicis longus, tendon of extensor pollicis brevis, tendon of abductor pollicis longus, superficial branch of radial nerve, radial artery, cephalic vein, cutaneous branch of superficial radial nerve, cephalic vein, etc. So now let's go. So the contents are also done. One is radial artery, one is superficial branch of the radial nerve, and one is the cephalic vein. Now clinical anatomy. Number one, the fracture of the scaphoid bone in the anatomical snuff box. you can see the fractures of the scaphoid bone in the anatomical snuff box. The scaphoid and the radius articulate to form the part of the wrist joint in event of a blow to the wrist. As for example, falling on an outstretched hand, the scaphoid takes most of the force. So fracture of the scaphoid bone can be seen. If localized pain is reported in the anatomical snuff box, a fracture of the scaphoid is the most likely cause. A fracture of the scaphoid can disrupt the blood supply to the proximal portion. The scaphoid has a unique blood supply which is unidistal to the proximal. Failure to revascularize the scaphoid can lead to avascular necrosis and future arthritis for the patient. These are the some clinical anatomy, and also you can feel the radial pulsation here as because there is presence of radial artery. So this is for now. I think I have cleared all the concept very clearly. If you have any query or any doubt, comment down in the comment section. I will try to reply your comments and doubts, and also suggest me in which topic you want the next video. Do like, share and subscribe for supporting me, and thank you so much.